Thank you, Sahari sir and Dr. Nishad. Uh, Good evening, good afternoon, and good morning. This is the 1614th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. VAIDEHI K. Bhatt. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day in Hindi is already over, and from 7:30 to 8:30. From 8:30 to 9:30, we have an international session in English, and from 9:30 to 10:30, a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same in the very next day itself, so that those who missed the session can watch it again, and you can subscribe it without paying any money, as well as you can share it with your friends, so that the purpose of this forum is to take homeopathy to every house around the world. And let me come to today's guest. As you all know, today our guest is Dr. VAIDEHI K. Bhatt. She is the HOD and Professor, Department of Homeopathic Pharmacy, L.R. Shah Homeopathic Medical College, Rajkot. She is working as a clinician in her own clinic as Vedic True Health Care. And she is a very good administration in college level. She had a lot of training exposure in different things in college, and she is a person who gives Instagram live session on PAL homeopathy calls on topic PCOS, a myth and fact, and she is a resource person in Prasad Bharati All India Radio Doordarshan in Health Program, and Nirmay on topic of child obesity and homeopathy on 29th April 2023. She is a very important person in publication of in the college sector, editor of the issue, the title Beneficial Troubles Bulletin Homeopathy Excellence in 2015 in August. She has presented a lot of research papers, and she has published many clinical papers on the research work related to homeopathy. There are many things in that. She had a very good achievement. She has a research paper presentation on Aish, India in Expo 2018 on the topic management of postpartum depression with homeopathy under category of mother and child health care with homeopathy. So many achievements in her kitty, and she has won many awards also for the same. She is a person who is having some extracurricular activities. She has managed the cultural first Teachers Day and so many things in college level. And today the topic is unmasking the enemy, insight into viral fevers. It's a very important factor subject. Unmasking the enemy. We people, all of us know that there are certain things that comes in the way, and they make troubles for person. So let us proudly invite Dr. VAIDEHI K. Bhatt to the session. Yes, doctor, you can present for the next 45 to 50 minutes, and then we will have a discussion.
Good evening, sir. Thank you, Danesh sir, for the introduction. Thank you, Sahani sir, for again inviting me on the same platform. Good evening to all the available guests and attendees of IFPH platform, who is regularly conducting this daily series of this 3 session, and it is seriously, sir, really it is commendable job to conduct these sessions regularly. Sir, PPT is visible to you.
Yes, yes, it's visible. It's a full screen now. Yes, very good.
Okay. So today's my topic is I'm asking the enemy insight into the viral fevers, and we will go for the major component of it, uh, from introduction to the how the homeopathy works in a various viral fever. So, as we know, viral fevers are one of the most common health concerns worldwide. As we know, just a small virus of COVID-19 has been in a cage for more than 2 years. So, worldwide, viral fevers are affecting millions of population each year with the rapid spread of viruses and their ability to cause widespread outbreak and understanding how fevers are manifest and how they can be treated effectively with the help of homeopathy. So today we will go for the detail about the viral fevers and about the causes, symptoms, and transmission and patterns of the developing viral fever. And we will focus on the homeopathy to treat this kind of viral fevers. So, by examining the principle of homeopathy and its individual approach to treat the each and every case and taken as a each and every person as a new case, we aim to shed a light on how it can help to strengthen the body's immunity response and support recovery from the viral infections. So, through this session, we hope we unmark the enemy, that is viral infections, and we will try to empower every individual with the valuable insights into the effective management of homeopathy. So, worldwide, if we see the number of cases, viral fever affects the population across the globe. As we know, COVID recently, pandemic, we all are the sufferer from the COVID. Then certain viruses are more common in a specific regions like dengue. Recently, dengue cases are we are getting since last 3 to 4 months. So dengue, Zika viruses, and certain endemic tropical and subtropical viruses, influenza viruses, that is common, and they are transmitting viruses typically through the direct contact, infected individual like respiratory droplets, and certain viruses like Zika and dengue are vector borne, and certain are fecal-oral route spread like hepatitis A, hepatitis E, and certain are blood-borne like hepatitis B and hepatitis C. Certain are airborne like influenza, COVID-19. Certain seasons are very favorable to the development of the diseases of the viruses, and most commonly we will find this type of cases in a winter months where temperature is very low, and dengue fever is very common in a rainy seasons due to the freshly accumulated water in tropical areas. And children and adult one are the at the higher risks, and they are more suffering with this kind of viral infections of and on. If we go to see the incidence and prevalence, moreover, as annual cases of seasonal influenza can reach millions worldwide, while dengue cases have been steadily rising in endemic areas, and there's certain kind of viral infections having a new strains like influenza, novel coronavirus, and these are the nowadays ongoing challenges to us and to the public health. So, impact, what is the impact of viral disease on a healthcare system? As we know, the widespread of viral fevers, especially during seasonal peaks, can strain the healthcare system. Hospitals may face the surges in a patient numbers, requiring efficient management and coordination of the resources. So if we go for more about the detail of the certain examples of viral fevers, as we know dengue fever, in 2023, India reported around more than 1 lakh cases of dengue with the highest number and in a certain state like Kerala, Uttar Pradesh, Delhi, and total number of dengue cases in India was fluctuated, and it may reach up to the lakhs due to the climate changes and urbanization. Then the chikungunya, we have a chikungunya epidemic in Gujarat in 2016, and still we are facing the problems related with the post chikungunya fever, arthritis, and nowadays it is also common due to the winter season like dengue. Number of cases of chikungunya in India as day by day increases, especially in Karnataka, Kerala, Tamil Nadu, and the Zika viruses. It is vector borne, coming with the zoonosis, and it is mosquito borne or transferring illness. And outbreak is reported in Kerala in 2018, and more than 100 cases was confirmed were suffering with the Zika viruses. COVID-19, as we know, pandemic was begun in the 2020, and uh, it is latest data found in a 2023. In India, only over more than 44 million cases and more than 5 lakhs death from the COVID-19 during that epidemic. And with vaccination campaign, also preventive measures, also the number of the cases have decreasing, but still we are getting the cases related with the COVID-19. Nowadays, strain is changed, but manifestation is more or similar like COVID-19. Then hepatitis A, B, C, E, having a significant viral fevers in the India. It is due to sanitary standard, contaminated water. We will find the more cases of the hepatitis A. Hepatitis is a self-limiting viral disease. Still, person is suffering with it, and mortality can occur with this virus also. And hepatitis B and C having a chronic suffering, and we will find this cases more than 40 million in Indian live. They are living with the chronic hepatitis B and C, and lead to with the time being cirrhosis and cancer of the liver, and needs transplantation of liver and more treatments. Other viral fevers are Japanese encephalitis, rabies, measles, and also contribute in a viral illness. So, National Center for Disease Control and State Health Department have a regular monitor over the viral disease and cases of the viral fevers, and they are giving the exact data to us. Is viral fever. As we know, moreover, suffering of the patient, various cases we are getting of the various viruses. So, exactly what is the viral fever? So, originally, fever is the evolutionary response of the increasing the body temperature to stop the multiplication of the invading microbes in the body. And if the fever of the viral origin, it is called viral fever. So we can say fever as a protective response for our body to prevent the microbe to grow in our body. So, fever meaning the normal core temperature of the humans could vary between the 97.7 degree Fahrenheit to 100 degree Fahrenheit. So, any increase in the body temperature is called fever. Hypothalamus is a small structure situated deep in the brain, and its main function is the maintenance of the homeostasis, that is the keeping body in a stable state. So, which includes regulation of the body temperature as well. And the hypothalamus often develops a new regulatory set point causing fever for various seasons after getting infection or any inflammation. So a common immunological response to a plethora of bacterial and infections is seen not only in the humans, but we can also observe rise of temperature in animals. So viral fevers is a collective term used for the fever originating from the viral infections. Temperature is more than 18.4 degree Fahrenheit, and they are classified into the low grade and high grade fevers. If low grade, it is a temperature below the less than below 100 degree Fahrenheit, and if it is high grade, then to the 100 degree Fahrenheit, as we observe in a cases like dengue. So what are the symptomatic representation of viral fevers? So various symptoms are associated with the viral fever. They can vary depending on the type of viral fever and can also vary from person to person depending on their immunity. So there may be a high grade fever can go up to the 103, 104 degree Fahrenheit, headache, sore throat, running nose, nasal congestion, muscle pain, joint pain, it may be mild to severe, dehydration, diarrhea or abdominal pain, nausea, vomiting, fatigue, dizziness, laziness, chills, redness, rashes. As we know, in a person suffering with the dengue and chikungunya, they develop a rash after the remission of the fever spike. So rashes, burning of the eyes, facial swelling, and loss of appetite. So what are the various kinds of viral fevers? So if we know the classification of the viral fever, that depending on the various factors such as transmission, severity of the disease, which organ of the body is affected, and etc. So viral type will also depend on the type of virus causing infections. So broadly, viral fever can be classified under the respiratory system affecting virus, gastrointestinal system affecting virus, exanthematous, hemorrhagic fevers, and neurologic manifestation. So if we go for the detail of the respiratory fever, someone is suffering like a flu-like illness, cold, cough, sore throat, fever, myalgia, body ache, and this is caused by the adenovirus or respiratory syncytial virus infection or severe acute respiratory distress syndrome, and COVID-19, of course, we can't forget it, and parainfluenza virus infection. Gastrointestinal viral fever, it associated with the gastrointestinal disturbances like diarrhea, vomiting, abdominal pain, nausea, etc. And it can be caused by the rotavirus, commonly seen in children below 1 year, and norovirus, astrovirus, and few adenoviruses. Then exanthematous viral fever, the viral infection is associated with the skin rash. Example like measles, chickenpox, chikungunya, rubella, smallpox, even a dengue. So hemorrhagic viral fever, that is the classical dengue fever, and exanthematous viral fever. And in a hemorrhagic fever, it is associated with the damage to the circulatory system and causing bleeding in a various orifices and causing bleeding tendencies like hemorrhagic dengue fever, Ebola virus, Lassa fever, yellow fever, etc. The neurologic viral manifestation can be like associated with the nerve damage like rabies, polio, and viral meningitis. So these are the brief things regarding the viruses that are commonly we are observing in a society, in a population, like influenza virus, dengue virus, chikungunya virus, COVID-19, mononucleosis, and hepatitis A. So influenza can cause fever, cough, sore throat, fatigue, dengue fever, high fever, severe headache, joint and muscle pain, chikungunya fever, joint pain that is aggravated in the morning, stiffness after rest, and rash, COVID-19 fever, cough, loss of taste, smell, fatigue, then mononucleosis fever, swollen lymph nodes, sore throat, hepatitis A, fever, jaundice, fatigue, abdominal pain. And these are commonest viruses that we are going to or we are observing day by day worldwidely. Though what are ways of transmission of the viruses or mode of the transmission or infection? So common are the coughing, sneezing, or contacting to the surfaces or object which contain a virus. As a someone with viral infection has touched like countertops, doorknobs, phones, Sexual contact like vaginal, oral, and anal contact. These are the common spread route for hepatitis B and C, as they are spreading with the sera and bloodborne products. Then bites, usually infected insects like the mosquito and ticks like yellow fever, dengue fever, chikungunya fever, and contaminated food and water like hepatitis A. So, what are the pathophysiology behind the development of fever with the viral infection? So, fever, as we know, there is the increase in a body temperature, and this regulator of body temperature is lies in a optic region of anterior hypothalamus near to the floor of the third ventricle. So, in exogenous fever, they're producing substances, pyogens such as bacteria, bacterial endotoxin, antigen antibody complexes, yeast, viruses, and certain ichthyoquinone may stimulate the formation and release of the endogenous pyogens, and that will lead to production of or increased number of neutrophil monocyte, hepatic Kupffer cells, splenic sinusoidal cells, alveolar macrophages, peritoneal lining cells, and these are believed to introduce the synthesis of prostaglandin in the hypothalamus. So this increased prostaglandin will lead to with this increase prostaglandin, there is also increase in interleukin 1, interleukin 6, and tumor necrosis factor like inflammatory markers of the body. Then body's thermal state is then reset a higher setting, and the patient whose own temperature is below that of the body, their most experiences a chill. Then the this peripheral vasoconstriction, shivering, central pooling, and this changes in a behavior activity like putting a sweater or drinking hot tea lead to an increase in a body temperature. So what are the exact mechanism of the virus can cause in our body? First of all, they can cause invasion in our body. They will get into entry through the certain route like respiratory route or through the GI tract with the contaminated food, water, or with the insect bite. They will target the cells. As we know, they don't have their own RNA, DNA, so they are using our RNA and DNA for developing into the host. So they are attacking this genetic material depending on the type of virus, RNA and DNA. And then they will causes replication of their self by using our material. Then our immune system becomes active. They will detect the presence of this specialized foreign pattern material in our body, and that's why our immune cells such as macrophages, dendritic cells, releasing a signaling molecule called cytokines. And this cytokine triggers the inflammation, which is responsible for the symptoms like increase in our temperature, body ache, and fatigue. So this fever induction, cytokine stimulate the hypothalamus and the body thermost, it raise the temperature. And this higher temperature, slow viral replication causes slow viral replication and enhance the activity of the immune cells. Now that's why I told in a definition of fever, it is the protective response of the body because it will slow down the viral replication of uh, in the body. Then symptom development, as this replication will going on, fever will develop as a protective response. Then body ache caused by the cytokines and tissue inflammation as interleukin 1, 6 and tumor necrosis factors are increasing. That will causes body ache. Prostaglandin will cause body ache. Then fatigue, the energy shift to prioritize immune system activity over the body functions. Next phase comes the recovery and immunity. If virus will clear from our body through the help of antibodies and cytotoxic T cells, there will be a decrease in a temperature and memory formation as body develops immunological memory, reducing the risk of future infections by the same virus. So, what is the exact impact of viral infection in our body? Viral fevers are mostly self-limiting in many cases, but having excessive immune responses, and that's why they causes cytokine storm, and that will damage the organ. And this understanding of this mechanism is crucial to prevent the organ damage caused by the viral fever. Then, how can we diagnose the viral fever? As a physician, we will observe the symptoms and signs represented by the patient. We will take the medical history, and if needed, we will go for certain blood test like complete blood count, comprehensive metabolic panel, coagulation test, liver function tests, evaluation of certain associated superbacterial infections also, common urine analysis, urine culture, chest x-ray, blood culture, serological testing for the viral specific IgM and IgG antibodies like dengue card test, chikungunya card test, COVID card test. Later on, to find out the liver or organ or lung damage, we can recommend to do CT scan or MRI of the lung, and in case of viral encephalitis, we will go for the analysis of MRI of brain. Then our topic, main stuff, homeopathic approach, how we can treat this condition homeopathically and prevent society from this suffering. So, according to homeopathic views, homeopathic approaches viral fever with a unique philosophy that emphasizes the individualized treatment and holistic care. We will take patient as a whole. So, instead of mainly targeting the virus, homeopathy focusing on the enhancing the body's natural defense mechanism and restoring overall balance. So, what are the key principles of homeopathy in a viral fevers as our low similia similibus curenta like cures like that can help person to treat in a minute doses than individualized treatment. As for example, we are giving a specific remedy to specific individual depending on their specific symptoms, emotional state, and overall constitution. So, with each and every patient, our medicine will change because we believe every patient is unique. So, fever accompanied by anxiety may require the aconite, while lethargy and weakness may call for gelsemium. These are the example of a specific remedy for the viral fever. Then the vital force, homeopathy believes in a body's intrinsic ability to heal itself, and it is does by the vital force. So remedies aim to stimulate this force, enabling the body to overcome the viral infections naturally. Homeopathic treatment is gentle and non-toxic. It is very safe for the all the age group, and it can support the immune system and enhance the immunity to fight against the viral uh, stuff. Then certain remedies will help to treat the symptoms and produces a preventive cure in a patient. So what is the exact role of homeopathy and managing fevers? It will reduces the severity and duration of these symptoms such as fever, body ache, fatigue. It prevents complication by addressing the root cause of susceptibility to viral infections and enhances recovery by restoring balance and vitality to the body. So according to organ on of medicine, what our father Dr. Hanuman said, he said in a aphorism number 26, every remedy for a disease is one that produces a symptom in a healthy individual that are similar to those produced by the disease. So this is the foundation principle of homeopathy. So homeopath will look for a remedy that matches the totality of the symptoms of a patient experiences during viral fever like fever, chill, weakness, body ache, and any other associated physical or mental symptoms, and depending on that we will select the medicine like aconite, belladonna, gelsemium, bryonia, depending on the picture presented by the patient. Vital force and disease that he stated in aphorism 9. Hahnemann emphasizes that illness occurs when the vital force is disturbed, leading to symptoms that are manifest of this imbalance. The role of homeopath is to restore the balance of the vital force to the right remedy. So, viral fevers are seen as disturbances of the vital force caused by the external noxious influences. And this remedy must be selected to restore the harmony to the vital force, not just the addresses the physical symptom. So as we know, a remedy like a gelsemium, it is indicated for the weakness and exhaustion and dull, dreamy drowsiness. And arsenic is for the restlessness, anxiety with the weakness. Depending on this, remedies are depending on the, we can choose this remedy depending on the individual state of the patient. Then the single remedy, aphorism 5. Dr. Hahnemann advocated that the use of single remedy that matches the symptom picture on a patient as closely as possible. So remedy should not be address the symptom but also work on a deeper level to cure the underlying cause. So despite this wide range of these symptoms during viral fever, would select one remedy that best matches depending on the totality of the patient. So this will lead to the crucial success in a treatment. Like aconite is for the sudden onset, eupatorium it is for the bone pain, fever, and general state of pain aggravated in the morning with the stiffness. And the minimum as stated in aphorism 247, minimum dose can prevent the aggravation and allow body to respond naturally to the remedy. So we will select lower potencies like 30C or 200C oftenly during the early stages of illness to avoid the aggravation and to provide a gentle but effective responses. Then the chronic miasm in aphorism 5560. Hahnemann says chronic miasm, psora, psychotic syphilis. We will discuss the each and every miasmatic representation in a viral fever later on. So viral fever representation can depend on the underlying miasmatic cause. Then the treatment of the acute diseases, aphorism 69 to 72. So homeopathic remedy should not only address the fever but also the patient's overall responses, because in acute disease we have to treat patient quickly and decisively because he is suffering with the sudden illness like fever. So next is the role of symptoms in a diagnosis in aphorism 83 to 104 in a case taking. So Hahnemann stresses an importance of careful observation of the patient's symptoms to make a accurate diagnosis. The symptoms are not just a physical signs, but it is the provide insight into the state of the vital force. So we will go in a detail of the onset, duration, associated symptoms, and patient's emotional state to frame out the perfect holistic picture and totality of the patient, and also diagnose the miasmatic state of the patient to find out the progression of the disease itself. And this picture will compare to the medicine. As we know, this similarity is the base for the selection of the medicine in homeopathy. Now, let us discuss about the miasms and their relation with the viral fevers. As we know, the SORA, fundamental miasm, state of deficiency and weakness. In viral fever, a person with the soric constitution may more prone to developing fever due to a weakened immune system and inability to resist external pathogens. So fever may be recurrent, low grade, and often comes after the exposure to cold and stress. So symptoms like chill, shivers, profuse sweating, coldness of the body, exhaustion, restlessness, tendency to be irritable, sensitive, nausea, vomiting during fever, sweat at the night, temperature rise in the night, especially during fever. And certain kind of medicines are related with this kind of psoriatic manifestation, like sulfur, where skin eruptions or condition like eczema often linked with the suppressed fever. Soranum, deeply suppressed condition that lead to chronic weakness. Arsenical, often used for the weakness and anxiety during fever, especially in a cases where the immune system is compromised. Psychotic miasm. Psychosis is related to suppressed gonorrhea and genital warts. It represents the excessive growth, suppression leading to state of internal intoxicity. So in a viral cases, psychosis is often prone to long-standing chronic condition that lead to weakened immunity, making them susceptible for the infections like viral fevers, and their body tends to suppress or hold on to infection, which can result in a protracted or recurrent fevers. So there will be a chronic inflammation, mucus discharges, fever that may come with the purulent discharges and infection, cold, sweat during fever, then the suppressed fever with painful swollen glands, exanthemata, warts, and remedies are thuja, as it is indicated for the warts, suppressed gonorrhea, chronic infections, madorinum, having a history of suppressed gonorrhea, having recurrent fever and infection, natrum sulf, and a history of chronic suppression, like in a liver disorders, like hepatitis B, C, and yellow fever. Then the syphilitic miasm. Syphilis is associated with the chronic effect of a syphilitic manifestation like progressive degeneration and state of destruction and degeneration. So with the syphilitic miasm, there will be a severe destructive fevers, moreover acute and malignant in nature, having a high degree temperature, severe tissue breakdown or decay, extreme weakness, necrosis, and hemorrhages, severe exhaustion, extreme weakness, ulceration, discharge formation, restlessness, delirium, hallucination, then severe tissue pain, especially in the bones or joints. So remedies for the syphilitic viral fevers commonly like mercurius, having a decay and discharge during fever, Kali bichromica, mucus discharge and painful condition, syphilinum, deep-seated degeneration and tissue breakdown. Tubercular miasm, as we know, tubercular miasm is related with the tuberculosis and representing the chronic struggle of the survival, and we are having a susceptibility to catch the infections and degeneration. So this tubercular predisposition may prone to recurrent fevers accompanied by the debility and exhaustion, chronic cough, weakness, emaciation, evening rise of temperature, weight dry, painful cough, infections may cause the debility and infections. And medicines are calcarea cap like chronic weakness, respiratory issues, tuberculinum, having a chronic fatigue, recurrent fevers, and susceptibility towards infections, silesia, weakness, and tendency to infections. Cancerous miasm, as cancer miasm is linked to degenerative diseases representing the growth, stagnation, tissue breakdown. This cancerous miasm more prone to the chronic lingering viral fevers, deeper degeneration, weakness, and may be associated with the tissue degeneration and immune dysfunction. So chronic low-grade fever, night sweat, debility, lymphatic and glandular involvement, chronic infections, and weakness over time. So remedies for the cancer miasm, viral fevers, conium, chronic growth or glandular degeneration, arsenic album for exhaustion and debilitation. So as we know, in my every session, I'm correlating every condition with the GNM theory. As we know, GNM theory, German New Medicine, having a alternating healing approach that seeks to understand the emotional and psychological stresses that contribute to the disease. So according to the GNM theory, disease originate from the dynamic disturbances and followed by the functional and pathological changes. So thus the morbid conditions start with the conflict in a psych level and later on it reflects on the body. So common feature is the disturbance at all level of the man. So according to GNM theory, emotionally distressing event that we could not anticipate or we were not prepared from a biological point of view, like unexpected things. So this unexpected things implies that the unprepared for the situation could be detrimental for one who was caught off guard. So in order to support the organism during the unforeseen crisis, a significant biological spatial program on a stand for exactly that conflict in a intensely activated. The functions of the organ, so the biological individual is better positioned to manage and eventually resolve the conflict. So GNM theory related with the fever is related with the biological conflict or psychological conflicts, and that is related with the ectodermal tissue level. And this ectodermal tissue level conflict is always related with the separational conflict, sexual conflict, territorial conflict, and this biological special program are controlled from our cerebral cortex. So this virus causes fever due to this conflict development, surpriseness, unexpectedness, or unexpected things related on a psychological pain as a fourth biological law. So what is the rapportorial view? Fever by using homeopathic medical laboratory by Dr. Robin Murphy. We will find many medicines in a many rubric like stages, chill followed by heat. Many medicines are there. Then the sweat, arsenic, china, ipecac, nux vomica, pulsatilla. Then chill, then sweat without investing heat. The capsicum, causticum, lycopodium, miserium, petroleum, thuja. Heat followed by chill, calcarea, nux vomica, pulsatilla, sepia, stannum. Then the dengue fever, aconite, bryonia, eupatorium, catral fever, chickenpox infection, antimicrood, antimtat, belladonna, carbovich, pulsatilla, rustox, encephalitis, belladonna, camphor, hyoscyamus, influenza, arsenic, bacteria, bryonia, eupatorium, gelsemium. Nowadays, season is going on with this influenza infection, and we have various medicines to treat this viral flu-like illnesses. Then measles, aconite, apis bryonia, eupatorium, morbillinum. Then pulsatilla supplinum, measles. After measles, camphora, carbovich, morbillinum, pulsatilla, mononucleosis, calcarea, carcinosis, mercurius. Then the mumps, Baraitaka, Belladonna, Carbovich, Jaburandi, Mercurius pulsatilla. Specific viral infections, carcinosin, Gelsemium, yellow fever, arsenic, cadmium, cantharis, cadmium sulf, cantharis, carbovich, and zymotic fever. Various medicines are there like pyrogenum, rustox, sulfur, muriatic acid, lachesis, lycopodium, echinacea, crotalus horridus, califos. So in a canned repertory, fever under the fever, we are having a three chapters. Chill contains 101 rubrics, that is the main rubric, and sub rubrics are different. Then in a fever contains 90 main rubrics, and perspiration contains 97 rubrics. So now let us discuss about the certain medicines related with the homeopathic materia medica. So homeopathy offers a wide range of remedies tailored to the specific symptoms presented by the viral fever. The treatment is based on a simple principle as we discussed, similia similibus cruenter. So we can choose the right remedy for the patient depending on their symptoms, onset and overall state of the patient. So as for the example, if person is anxious, having a high fever, aconite, if sudden fever is there. Fever comes with the intense body ache and dry painful cough and patient is not able to move. Even slightest exertion will causes pain. Bravo may be selected with the agitation of the mind. So let's go into the deep diagnosis of various medicines in our homeopathic materia medica. These are the few examples of the medicines only. Otherwise, we have various, or many medicines indicated. We can indicate for viral illnesses. Aconite, sudden onset of the fever after exposure to cold shock. Symptoms are sudden high fever, restlessness, dry skin, intense thirst, anxiety. We can indicate aconite to calm down the patient and reducing the intensity in an early stage of fever. Then the belladonna, in case of high fever with sudden onset, high fever, flushed skin, hot dry, throbbing headache, sensitive to light, delirium. Action, it will intense fever, inflammation, especially when the patient has a red hot appearance. Then jalsemia, having a extreme weakness, very tired, very dizzy, dull, with chilliness, body ache, fatigue, and the symptoms was on a moment. It helps to reduce the weakness, muscle ache, fatigue, commonly like a flu-like illness. Then the bryonia, having a dry cough, that pain with the pain in body parts that can aggravated by the slightest movement, dry painful cough, intense body ache, headache. It will relieve the muscle ache, headache, and dry cough, promoting rest and recovery. Eupatorium perforatum, indicated remedy for the chikungunya and dengue-like illness with the intense bone pain, fever with the severe aching, soreness in the bone, chill, nausea, vomiting, and it will relieve the severe bone pain, chill, weakness associated with this yellow fever, dengue fever, Zika fever, and chikungunya fever. Rustocks fevers with the severe joint pain, restlessness, aching in a joint, restlessness, which patient need to constant movement to relieve this pain, and it will help to relieve the muscle and joint pain and promoting uh, release of this stiffness of the joints. Then arsenic, having a gastric symptom, restlessness, anxiety, burning pain, diarrhea, vomiting, and extreme fatigue, and fever with exhaustion, dehydration, diarrhea, vomiting can recover with arsenic. Chinium sulf, fever with recurring chill, periodical fevers, headache, and it is useful in a cyclic pattern like a malaria in a viral fever. Then baptisia, Baptisia is indicated for the septic or toxic fever, high-grade fever with confusion, foul-smelling discharges, foul-smelling sweat, and sense of body heaviness. And if a person having a delirium or sensation as if the body is breaking in apart or decomposition, we can select the baptisia. Phosphorus for the fevers of the respiratory symptom and bleeding tendency, low-grade fever, dry cough, burning in a chest, bleeding gums and nose. It is effective in a viral fever affecting the lungs and indicated in a post-viral pneumonia. China, fever with the weakness, exhaustion, sweating, headache, and significant fluid loss. It is indicated for the person recovering from the debilitating viral fevers. Ferrum force, it is indicated for the early stage of fever where fever is mild and having unclear symptoms, low-grade fever, general weakness, and flushing of the face with the intense inflammation. And key indicators are the slow developing fevers without a marked symptom. Then the ipecac, fever with the persistent nausea and vomiting and difficulty in breathing. Moreover, it is related with the digestive and respiratory system. Pyrogenum, having septicemia-like fever, septicemia-like symptom, high-grade fever, offensive discharges, rapid pulse, extreme restlessness, and it is indicated for the infectious fever or septicemic fever. Then Miserium, fever with the intense neuralgia and skin eruptions, burning in a skin, neuralgic pain, eruption with the fever. It is suitable for the viral fever associated with the skin manifestation like measles, like chicken pox, like smallpox. Then Ascicococcinum, it is used for the preventing and treating the flu-like symptoms, fever, chill, body ache, and general fatigue at the onset of the flu. So it acts as a preventive and symptomatic remedy, uh, like in a fever, like a influenza. Then the lachesis. Lachesis, my personal experiences with lachesis is very good during the COVID. During COVID, it is indicated to reduce the D dimer and it acts marvelously to reduce the D dimer in a COVID patient. So, for fevers with the circulatory symptoms or septic state, high grade fever with purplish discoloration, throbbing headache, sensitivity towards the touch, aggravation in a sleep, and a person having a hemorrhagic tendency. Then Crotalus horridus. Crotalus having a bleeding tendency and jaundice-like symptoms, high-grade fever, bleeding from the orifices, yellowish discoloration of the skin. Now, as lachesis have a purplish discoloration, Crotalus, neck remedy, same, having a purplish discoloration of the skin. Then the extreme weakness, effective in a hemorrhagic fever with the viral illness affecting liver. Then the sickle cord, fever having a burning sensation and gangrenous tendency, cold clammy skin, burning pain, purple black discoloration affected area, and rarely used but highly effective in severe cases of septic viral infections. Then anthracene, fever with the abscess and carbuncle, high grade fever, burning pain, tissue destruction, offensive discharges. It is indicated for the secondary skin infection or abscess formation after the viral illness. Then melandrinum, post-viral complications or vaccine reactions, fever with the skin eruption, pustules, complication following vaccination. It, it detoxified, act as a detoxifier in cases of viral fever where skin involvement is there, or vaccine induced symptoms or post-vaccination symptoms or fever are there. Then both hopes, fever with the clotting disorder or stroke-like symptoms, high fever, paralysis, slurred speech, bleeding due to the clotting abnormality. It is indicated for the fever related with the nervous system or blood
Yes,
coagulation. Carbolic acid,
yes,
G
Doctor.
sir.
Yes, Dr. Vaidehi. How many slides remaining?
Uh, Sir, just material portion and one case. Will
I hope
just
we
complete the material portion, sir. We don't go for the details of the case.
we
We'll just give a brief idea about the case.
we can have a second part of the same because it's a very important subject and very uh, good for every homeopath to study things in a better way. So I
O-
think we can go somewhere here and then we can present it in February first week or second week as per your convenience.
Okay,
Yes,
sir.
if we are ready, then we can go ahead because it's a very, very important subject we are discussing. You are presenting here. Am I right?
Sir, if we have 5 minutes, we can complete the material portion with that.
Dr. Beatrice and company all are raising hand. They want to ask some questions also because there's so definitely we can start the session from this part again so that from the market itself you can go in a slow way also. You're running like a 2020 cricket game now. So it's okay. Let's let's conclude here and then let them ask some questions and we can start from Murphy repertory for the second part. Okay.
Okay, sir.
Okay. Thank you, Dr. Vaidehi, but for your excellent session. As a homeopath, we need to know all about fevers and viral fevers and causes, everything you discuss. And so I invite Dr. Beatrice to come forward and you make your comments and your questions also.
Okay, sir.
Yes. Yes, Dr. Vaidi, thank you very much for your excellent presentation. And it's also very nice to see how many remedies we have. And I have an important question for me about dengue fever. I am talking
Yes.
from Germany. We don't have dengue fever here. But like our daughter is traveling in Brazil, I will go to Argentina. they have dengue fever actually over there. So my question is,
Yes, ma'am.
as I know, the first infection normally with dengue fever is more or less with fever and pain in the bones. We have remedies like Eupatorium, perfoliatum. That would be good.
Yes.
But they told me in Argentina there can be a second infection which can be much more severe. So my question is, do you see that second infection with severe problems often in India, or is it more an exception?
Ma'am, we are not found the exact secondary same dengue fever like illness on a same phase within a month or 2 months in a same person. Yeah, we will find certain dengue illness in a person in a next outbreak after a year or 2 year. Within a month, we are not facing any this type of cases within a month or within a 15 days. They are suffering with the same kind of feverish illness. So if it is occurring, I will suggest to repeat the medicine depending on the characteristic of the person. And they may be, as I told in a GNM theory, there may be a certain conflict is there. And I observed this personally in a COVID patient also. Says
Yes,
a
I see.
person is
Yes.
having an outbreak and 10 to 15% are related with this or directly come in a contact with a person suffering with the COVID, and everyone is not getting exact COVID like symptoms, and few of them are getting COVID symptoms after this sudden surprise, and I have come with the contact with the COVID patient and now I am
Yes,
suffering
thank
with
you
the
so much.
COVID.
Thank you. But
So
please, my question is, like you have 100 patients with dengue fever. If in their life, again, they will get another dengue fever, how many of 100 patients more or less will have severe conditions like failure of organs, bleedings, all these severe conditions? Or perhaps Dr. Danesh, you also know
In
about that.
India, in India nowadays we are facing classical dengue fever rather than hemorrhagic dengue fever. We are
Yes.
finding the cases related with the classical dengue fever, and at presently we don't find a specific breakdown in a platelet and typical hemorrhagic dengue fever. Yeah, person is suffering with the body ache and weakness, exhaustion for the prolonged time, but uh, with the God grace, at presently we are not facing any hemorrhagic conditions. Yeah, in a
Okay, thank you.
2017, we have a dengue outbreak, and at that time we have this hemorrhagic dengue fever, and at that time we will observe this certain breakdown of the platelet. Now, person come with the 110 lakhs platelet on a day, and on the next day, the person is suffering with the less than 40,000 of the platelet in a single day. And after giving medicine, they are recovering for the 2 days. And after 2 days, again, this load comes of the breakdown of the platelets. Thus, 40 can come to the 25. And person and family members are going in a serious condition. What is going on? But this 25 platelet will suddenly boost to the 80,000. So this stuff we will observe in many cases, and at that time we will indicate lachesis, crotolus, like medicines to bring this boost of the platelets.
Yes,
Thank you
excellent.
very much.
Excellent, excellent. This is something that we used to get, but in Kerala and in most part of India, the dengue is just like any viral fever. People are coming with because lot of master areas are here, and a lot of
Yeah.
those are flourishing like anything. And sometimes you get most of us get this disease, and people don't take it as a serious problem nowadays. And what we find is that when the patients visit to the other system, they give antibiotic without knowing that this is a case of dengue. So what happened is that all of a sudden the platelets will come very down. It may go,
Yes, sir.
and thereafter they may not be able to maintain the patient, and then naturally by there may be hemorrhagic type.
They require fluid therapy, sir, to wash the or flush the face Mainly indicated remedy for the viral fever, what I observe is the continuous intake of the fluid rather than infusion of the water. If person is able to take water and fruits, or you can take substances rich in a water, they will recover very quickly. Now, what is the problem we are observing is lack of the taste in a mouth and aversion towards the water. So we can remove this tendency with our medicine, and if person will take the
Yes, ma'am.
water, he will recover by himself or herself.
Yes, definitely the second instance can be prevented with if the person is undertaking homeopathic treatment. Definitely no recurrence will happen because we have a doctor has mentioned about the three philosophy, like that. All those miasm theory. Then you can apply the anti-miasmatic remedy in those cases, and then we can avoid the second infection. Then definitely no patient will come out second with the second infection. Anyway, it's the time to wind
Okay.
up the session.
Thank you very much.
Thank you.
I invite Dr. Indranil to say a vote of thanks to this session.
Yeah, am I audible? Yeah. Yeah. Dr. Vaidehi Bhatt, we are very thankful to you from IFPH. You have, you have touched a very important topic.
Thank you,
The
sir.
time was very limited. We expect a new lecture from you as per Dr. Dhanesh sir's permission. We'll definitely think of it. And you have done a good study and you have explained us in a very good way. So I'm thankful from IFPH. So thanks for your
Thank you, sir.
lecture of today. Yeah, yeah. Welcome.
Thank you, sir.
Thank you, Dr. Indranil Pavalkar. And now it's up and Dr. Vaidehi Bhatt and those who are in the session. And tomorrow we will have a session from Dr. Yahya Parakavati, and he will be talking about homeopathic tonic. That's an entirely different tonic, not like what you are expecting about the tonic. So hope all of you will be with us tomorrow at the same time. Thank you all. Good night.
Thank you, sir.
It's over to Dr. P. Shaila to moderate the next session in Malayalam.